Hello, welcome back again. Sorry for the technical difficulties. Um, as I was saying, just to start over, I'm Evan Moore. This is just a general way of just kind of introducing myself. I'm new to the practice. Some of my background, I come from a family of plastic surgeons. My grandfather was a plastic surgeon. He was one of the first plastic surgeons in Lexington and started this practice. Then he had 5 children, 3 of whom ended up becoming a plastic surgeon, one being my father. And so growing up as a kid, I was kind of in the plastic surgeon environment. I remember going to round with my father at the hospitals, and I love the fact that he enjoyed rounding and seeing patients. And that's kind of what really got me into wanting to become a doctor and eventually into more plastic surgery because of the long-term care and really getting to meet and have a journey with patients that you get to meet. That's how I generally fell in love, and then the actual practice of plastic surgery came later. I'm born and raised here in Lexington, Kentucky. Went to college in Indiana, and then came back and did medical school here at UK, and then did residency at UK, followed by a fellowship in aesthetic surgery with a heavy focus in breast aesthetics. And that's kind of how I ended up with my training. I guess the next thing to talk about, things about me. I love meeting new patients. I love getting to know them, and I love the journey that we undertake when we do a procedure, and following the patient up, and kind of guiding you through all of that is just the part that I enjoy the most.
So Vicky writes in, she says, "Let the legacy live on."
Oh, that's awfully sweet of her.
Is that neat for you to be able to do that?
Yeah, it really is. I'm already meeting a lot of patients that my grandfather took care of just here in the practice that I'm going to end up taking over. And they are the nicest and most grateful people. And that goes so far. It does really warm your heart taking care of those people. And I look forward to it. I look forward to that aspect. Just the other day, I met an elderly lady that my grandfather took care of, and she was here with her daughter, who my grandfather also took care of, and they are seeing my father, and they're looking forward to coming and seeing me, which just just tickled my heart. I've really enjoyed that, and so that's the kind of atmosphere that we've got, and that I'm really excited to join that aspect of it. Any other questions?
Well, you showed me a picture of you and your father in the operating room. What was that, just a couple of weeks ago? And that was a first, right?
Yes. That's the other part of the dream of going through all that training was to do operations with my father. Even though that he is going to be retiring, he's going to keep his license to hang around, and we're going to do some surgeries together. Yes, that was great operating with him, and I look forward to more surgeries with my father. It's just generally just kind of nice to just hang out and learn from him, because everyone does things differently, and it's nice to hear his experiences, or just experiences in general, because I've also done surgeries with our partners here, Mike and Joe Hill, and I think they bring something different. They practice differently to each other, just in terms of just patient management, and they, just like me, we believe heavily in tailoring procedures to patients, because as my father always preaches, not only to me but to the practice, is that every patient's different, and procedures need to be individualized to that patient. People aren't, he always says, people aren't GMC trucks. You can't run an assembly line. And that's so true. You have to know the patient's goals, what their life situation is, and then work with them, and then kind of tailor a procedure to that. And that's kind of that's what also makes it hard, but also interesting and fun aspect of plastic surgery. To be able to, things are always changing, and you always have to adjust and be able to adjust.
So that first time, though, were you a little nervous, like, man, I'm in here with my dad?
No, I've kind of had small introductions because we do surgery on Sunday, and I have been able to do some small operations with my father, but just recently I've been able to do bigger surgeries with my father, which was very gratifying. Some of the I thought the other interesting thing is that recently all three partners, Mike Lynch, Joe Hill, and I, were available to jump in, all three of us in a case together, and that was a lot of fun. And that was just purely coincidental. We were just in the area, and we could stop in and help out while the other partner was practicing there. And so I look forward to that kind of interaction and enjoyment, because it seems like the partners enjoy to work with each other, and I enjoy working with them.
And so, speaking of surgeries, you wanted to focus on one particular procedure today.
Oh, yes. So, in terms of just patient education and being interactive, we wanted to just provide particular topics to talk about every time we do these Facebook Lives. One that I wanted to talk about was breast reductions, which are a very gratifying procedure to do when you find the right patients. And what I mean by that is there's two different types of breast reductions. There are functional breast reductions, and there's cosmetic. And there's no real difference in really the procedure. It's more of what are your patient's goals that separate the two. Functional is when you have very large breasts and you have back pain, you have shoulder grooving, you have poor posture, and you're developing neck pain and headaches. And generally most of the women that we've seen have put this off for a number of years, to the point where it's driving them crazy. And at that point, it's more, we call it functional, because we're reducing the amount and then lifting the breasts for pain relief, where a cosmetic one is more of the goal of you want to just have a smaller size breast and you want to be more lifted. And that's different from the breast lift, and only just kind of the general patient goal. Breast lift is more you lift the breast and don't really take much of the volume out, where a breast reduction would be you take some volume out that's tailored more to what the patient wants, and you lift the breast. And so that's something that you would meet with your doctor, have a discussion kind of about your goals and your timing, and it's a great way of rejuvenating the breasts, and also hopefully hitting the patient's goals. And that goes back to the whole concept of tailoring procedures to the patient, and that's a good example of that.
What is the best quote you've heard a lady say when she has the surgery done? Because I have a friend who's had it done, and she just says it's night and day. She just feels better.
Yes, that's so. Generally, if you're looking for the talking about the functional patient, they come in and it's been several years. They're having back pain. The other thing is it's affecting their daily lives. Like, they're not able to exercise or run. All they can really do is walk. And then by the end of the day, they're just exhausted, and their back and neck hurt. And after the procedure, it really is night and day. And we're not talking like a couple of weeks after recovering. We're talking about patients that are still in pain from surgery and they feel better the next day from just having the breast surgery and lift. That I thought that was incredible from my experience of doing all those breast reductions, is that a good portion of patients feel, even from the pain of surgery, feel better the next day just from having the breast lifted to a more natural position to take the weight off their back and shoulders.
What concerns do you hear from women of why not to do it?
They worry about some women, but generally not in functional, is taking too much breast tissue. Most of those women are just, they want as much gone as possible, but you have to do it safely in order to preserve the tissue so it's healthy. So you're kind of limited on some patients. But the other thing is scarring, which is not something that is people worry about up front, but they don't worry too much afterwards. And what I mean by that is you talk to them about where the incisions are and where the scars are going to be developing. But unless you have a history of bad scarring, which is nice to tell your doctor, we have an assortment of options here in the clinic that can help stay on top of it and prevent scarring. We can help prevent terrible scarring. There's always going to be a scar with surgery. It's just how do you minimize the look of it, and there are ways also in order to hide some of the scarring, which we can tailor to the patient as well. Holly here has a variety of options in terms of, just off the top of my head, scar cream that we've got with sunscreen and silicone. Silicone's shown to decrease scarring. We also have, after patients have healed, there's also options of scar massage, and they're down the road laser. Lasering can kind of help take some of the pigment off, and there's always the option of steroids to help kind of reduce. But this is a rare case scenario unless you've got a history of it. Most patients, I would almost say like 90% of the patients, do not, if you choose them wisely and talk to them about it, they do not have a problem with the scarring. And reiterating, if there is, we address it and we get on it early. That's the whole concept of seeing your patients and following them up even after surgery for a while.
Anything else you'd like to tell those watching?
No. I'm just looking forward to doing more of these and hopefully being interactive with all your all's questions, and look forward to meeting and developing relationships with my patients.
Thanks for watching.
Yeah, thank you very much.